Example isn't another way to teach, it is the only way to teach. Albert Einstein. At Cook Children's, we're fortunate to have many employees who teach by example, who lead the way in helping to fulfill our promise. Our promise is for the children and families we serve, and no one understands that better than the physicians who treat those children every day. To recognize the great physicians who work to fulfill our promise by advancing Cook Children's national reputation, we've created an Endowed Chair program. The Endowed Chair program fosters an atmosphere of creativity and passion for physicians, allowing them the opportunity to develop brilliant ideas.
The Endowed Chair is money that the foundation has set aside to invest in the physician's creativity. It allows a physician to take some time away from the clinical practice and do some thinking about how medicine should advance, explore ideas that have come up as they've seen patients, and to publish, to get that information out into the world, do some research. All those things require time, and the physician can set aside that time because of the money that the foundation has invested in the physicians of Cook Children's.
The Endowed Chair program provides funds to support physicians as they create new programs, participate in clinical research, publish their work on a national level, and speak to physician groups or organizations. Cook Children's Healthcare System Board of Directors is proud to announce an Endowed Chair has been awarded to Dr. Paul Thornton, a distinguished physician in the Cook Children's Physician Network.
During my fellowship training in the Children's Hospital of Philadelphia, I worked with Dr. Lester Baker and Dr. Charlie Stanley, and these guys were two of the world experts in hyperinsulinism. And so I developed my love for patients with hypoglycemia at that time. The Endowed Chair is a wonderful thing for me because in the United States there's currently only 2 congenital hyperinsulinism centers, the one in Philadelphia and here in Cook Children's. This is a rare disorder. It affects about 1 in 30 to 1 in 40,000 newborn babies in the United States. And so when there are only a few centers, it's sort of incumbent upon us to gather that data, publish and teach everyone else about how to manage these patients. Professionally, it's very exciting to be able to do this because it allows me to have that extra time to do the things that make providing the care for these children even better. These are things that we could not have otherwise done without the funding.
The innovative work created by Dr. Thornton will help children around the globe, now and for generations to come.
What Cook is all about is that we absolutely support our physicians, and we want to see our programs at Cook Children's grow to be second to none. And when we set aside these dedicated funds through these endowed chairs and allow our physicians to have some protected time to really further develop some of their research and programs, that allows us then to be on the forefront in some of our services that we offer our children that we serve here throughout our region.
Soon, more physicians will be chosen for Endowed Chair recognition. It's an exciting time at Cook Children's. We're grateful for the support of our generous donors, supportive administration, and Board of Trustee members to create brilliant opportunities like these.
I take great pride in the fact that I get to work with these guys, that I get to spend my time trying to figure out how to foster their creativity and to keep their minds focused on the kids and focused on how to help them.
The bottom line, it's great for the children that we serve, but it also is good for our institution.
Families in Texas who come to Cook Children's and from around our local states will be getting the best care that they can get in hyperinsulinism. So it really does help get the message out there that we're not just a brilliant clinical hospital, but we also participate in innovative, cutting-edge research and publishing.